Well, of course, Ruben is out at Torrey Pines getting ready for that big golf tournament, and a lot of folks just love that sport or some other type of activity, but they're sitting at home right now. Maybe you're one of those folks watching this program, and you can't do that activity that you love so much because you're in some kind of discomfort. It might be your back, your neck. It might be some other ailment that's bothering you. We might be able to get you right back on your feet in a very short period of time, back out doing what you love, just if you pay attention to what's happening in the next couple of minutes here. Dr. Jamie Kaiser is here to get you back into balance today with Eric, is it Eisenman?
Eisenman, yeah.
A patient of his with a very, very interesting story to tell about how he was able to be helped by Dr. Kaiser. So, good to see you once again.
Good seeing you again, Mark.
And again, let's focus again right up front here on what we want people to do over the next couple of minutes here.
Yeah. Something.
Something.
Do something. It's like, you know, I think the theme of today's show would be how many things in your life have you come to accept as normal and you've made excuses for it. So, you know what, I've always had knee problems, but I went to the doctor, they told me I've got arthritis, so therefore it just must be the arthritis in my knee.
Back problems, neck problems.
I'm getting older, and, you know, migraines happen around the age of 40 because my hormones are changing, so that's just part of life. And
digestive trouble.
Digestive trouble. Well, you know what, I eat spicy food, it rips up my stomach. That's just kind of what's my family, my sister's got it, my brother's got it, so it's just part of my life. Not true.
So what might all of these things have in common?
Well, your nervous system controls everything in your body. And so when your nervous system is not working correctly, functioning like it should, it's going to manifest in a lot of different ways. We correct structural imbalances to allow the nervous system to work properly, and good stuff happens.
Now, back into balance is a form of, as a way of adjusting what's going on in your neck so that the nerve impulses from the brain can travel freely down through the rest of the body.
Structurally, everything in the world has to pass from your brain through this point. And so conversely, if we're not in the right place structurally up top, it's going to affect everything else downstream.
Now, if you want a name for it, folks, it's called NUCA. But that really isn't so important as the fact that you remember Dr. Kaiser and then listen to what Eric Eisenman here has to say about his situation. So, Eric, we described a whole bunch of different maladies here that might be related to this, this blockage of the nerve system. What was your condition now before seeing Dr. Kaiser?
Well, a couple things. I mean, I'd been seeing a chiropractor since I was 15, and one of the things that always came up for me is every few months I would get a sore throat. And I began to notice that my neck was hurting every time that I got a sore throat, so I would go get adjusted. And then my sore throat would amazingly clear up. Well, since seeing Dr. Kaiser, it's been about 4 or 5 months now, I haven't had any issues with my neck going out or hurting or feeling like it's going to come out, or and no sore throats.
Now, what about pain? Now, do you something like fibromyalgia?
I've been dealing with fibromyalgia type symptoms since I was very, very young.
Now, this is something that we're only really very recently kind of coming to understand, isn't it, Doctor?
I don't even think we're coming to understand a dang thing about it. I think fibromyalgia, in my opinion, it's a garbage bucket diagnosis. That does not mean that your pain isn't real. That does not mean that there's something wrong. But fibromyalgia just means you got a bunch of sore spots on your body that if we push on them, it hurts. And again, oversimplifying here, I may get some phone calls later, but
I think that's great.
Garbage bucket diagnosis, because you got problems, you got pain, great. Here's a prescription to take away pain. Great, okay, I'm happy, higher quality of life, but what does that do to my liver, my kidneys, everything else down the road? And what if I stop taking it? Does it go away? Let's look at a structural problem first. If we can correct that, then we don't need to drug ourselves up for the rest of our life.
So now yours was pretty severe again. It was probably limiting the kinds of activities that you could even get out and do and enjoy.
Yeah, I mean, I had problems in my neck, my upper back, severe cramping in my thighs and hips. And, you know, I got into Japanese massage just for that reason, because I wanted to figure out what was going on in my body. And, you know, it would limit me from, you know, going skiing, mountain biking, all the activities that I love to do. It would even limit me in my work.
Now, here's the fascinating thing. We're looking at pictures of you right here.
Yeah.
And you do these intense massages for people. And I know they get great relief from that. It helps them feel much better. But you couldn't even use this technique or have somebody use it on you and get relief. So you had to go on and look for something beyond that.
Right.
So is that how you found Dr. Kaiser?
Yeah, you know, I found Dr. Kaiser on this show, and what he talked about in aligning the top 2 vertebrae made so much sense to me, because in The ancient Japanese work that I do, I start at the hips and align the hips, and it works its way up. Dr. Kaiser starts at the neck, and it just sends the signal down. And what I've found, seeing Dr. Kaiser aligning those top two vertebrae, my whole body just seems more in balance and more straight, more aligned. And because of that, I think when I do the intense Japanese massage work, especially the thumb work, my elbows and my wrists and my thumbs would just get sore after a few days, and then I'd have to go get adjusted. Well, since seeing Dr. Kaiser, I've had no elbow pain, no wrist pain, and virtually no thumb pain. I've been able to do an extensive amount of deep point work.
Now, what we're looking at, what we're just looking
Yeah.
at there, was the adjustments that you do in
The
this
adjustment,
Nuka treatment.
yeah, it doesn't feel like much at all. I want to kind of dwell real quickly, go back on the thumb work. We're talking about an intense amount of pressure that he's applying,
Right.
through his thumbs. And it makes sense. Well, if I'm putting all my body weight, through my thumbs, well, duh, I should have some sore thumbs the next day. And so we start to accept that as normal. Well, I'm using this a lot, so therefore it must hurt. Or I go for a
It's a
run,
great example
my
of what you're
knees
talking about.
hurt, and therefore it makes sense that I went for a run. If you can correct the problem, the stuff starts going away. Maybe it had nothing to do with being 40 years old and having arthritis in your knees or your elbows or your wrists.
So, Eric, you come in for your first adjustment. You do some pretty intense massages,
Yeah.
traditional chiropractic, pretty intense. You've been through all that. What did you think of your first adjustment? What did you think was happening?
It was a pretty amazing, unique experience. I'd never seen a chiropractor like Jamie before, and I've probably seen 15, 20 chiropractors since I was 15. And the first adjustment, I don't know if I can explain it. It was like my body was resetting itself. It was pretty amazing.
So it was a bit disorienting, and then you were able to suddenly, realize, hey, I think I'm okay to drive home, and it got better from there.
Right, yeah. I mean, after the first adjustment, it was a little disorienting. It was like, he reset everything, and my brain just kind of started to rebalance itself.
And now you're not having those symptoms, and
Saw you like a month ago?
None whatsoever. Yeah, my last appointment was a month ago.
okay, folks, again, the whole point is to get you to do something today. So here's the doctor's offer for the first 12 callers to get you to do something, to try to get back to that active lifestyle and to reset what normal is for you. For the first 12 callers, he'll see you absolutely for free. And then beyond that,
you come in, you got a bunch of questions about, well, my insurance, how many visits, how often do I got to come, all that stuff. We answer everything up front. There's no charge for that whole entire process. If it makes sense to you, you want to move forward, it's only $49 for the x-rays. You need to make that appointment today, though. That's the only stipulation. When you call, you're going to get our call center. They are going to ask for a credit card number, strictly to reserve the appointment
they
time.
won't be charged anything
Not gonna be
unless
charged.
you decide to move forward after the consultation. $49 for the x-rays, which are normally over $200.
Over $200. Everything's up front. All your questions are answered.
Dr. Jamie Kaiser, great to see you. Eric, thank you so much for coming in and sharing your story. That's what we usually find causes people to do something when they hear from somebody else that's had a pretty dramatic experience. So thank you once again. Go see Dr. Kaiser. Do something. All right, for more information, you go to san diego6.com and click on San Diego Living. Up next.